Well, he's the man behind Australia's largest physiotherapy network. Jason T. Smith founded the Back in Motion Health Group in his garage in 1999, and 22 years later, it was acquired by ASX-listed Healthia for in excess of $100 million. Well, Jason T. Smith joins us now. Jason, welcome to The Wealthy Effect. Thanks for joining us.
Thanks for having me.
Began as a garage startup. Was it your intention at the time that you'd be selling a $100 million company?
No, I'm more surprised at my story than I think anybody else, to be honest. It was really just a hobby business. I was intending to go overseas with my wife to work in the developing world, and one thing led to another. And as they say, no overnight successes, but 2 decades later, it had become a substantial footprint.
Well, tell us a bit about your backstory, because you refer to yourself in the book as a failed medical missionary. So how did you actually end up in this space?
Yeah, so I from the age of 10, I always wanted to be a doctor, and I wanted to work amongst the poorest of the poor. I felt like that was God's calling on my life. And I didn't get into medical school. I went overseas and worked as a short-term missionary on multiple trips, but none of them came to anything. And so I'm stuck in Melbourne doing the suburban lifestyle, having to pay for rent. And so I get a job in the public hospital system. One thing leads to another. I end up starting a small consulting practice from home, all the while thinking this is just a short-term measure till I get to live out my real ambitions. But it never happened. I got, the thing grew, and we realised I could actually do more good in the far-reaching parts of the world running an ethical business on scale than just my wife and myself going on our own as volunteers.
Well, you say the thing grew. Well, it did, didn't it? But how did it grow?
Well, I mean, it's a mystery in some respects, because healthcare is not a very scalable model. It's a services-based industry, but we franchised that service format, and it was considered the dirty F word in healthcare. I mean, who wants to commoditize a professional service? But we found a way to do that in preserving clinical excellence and bringing a business format that could empower clinicians and practitioners to do what they love best, which is treat patients, while we handled all of the back end for them. And that really became part of the secret sauce that enabled this thing to expand right across Australia and into New Zealand.
Are there lessons for others in the healthcare sector?
Well, I mean, there's lessons for me still as I reflect on the story. It's like the business that keeps on giving in that regards. But I mean, a few things that I think about often is that, number one, relationships matter. I mean, beyond money and profit and just even building a brand or trying to build technologies to help your business, relationships matter. I think also it's important to understand that the hardships along the way, you learn far more in the pain and the suffering and the difficulties than you ever learn in the successes. And so it's kind of taught me not to begrudge those painful moments. And I think, in the world we live in today, technology is the great enabler. So even in a healthcare service model, understanding how to harness tech to give you greater reach, to give you efficiencies, I think has been essential.
Jason, you talk about your sticking to your convictions there. Of course, Australians are good at being knockers, aren't they? So did you have to sort of filter that out, if you like, and just stick with what you thought would work?
Yeah, I mean, there were plenty of times where I had a long queue of critics, far more than I had supporters. And it's because we were doing something different. We were trying to look around corners and see into the future and try some things that hadn't been done before. And that always attracts a bit of negativity. But I think as far as convictions go, these aren't things you get to choose often. It's part of who you are, and they're transformative beliefs you can't deny. It's more than just an idea. It's this belief that you are called to do something. And I think in my case, it compelled me, even when I had those long list of opposers. It conviction trumps genius and it trumps hard work. Conviction's the thing that keeps you going even when you're up against it.
Always great to have an idea, of course, but how important it is to have people around you to support that idea.
Yeah, business is a team sport, right? So anyone who's achieved anything of substance in their life knows that it's the people around them who make big and seemingly small contributions in the jigsaw puzzle that we call life. And so for myself, it's family, it's friends, it's colleagues, it's patients who supported our brand, it's suppliers who came on the journey with us. And so you're totally right. We need a whole cohort of contributions to make it there in the end.
Jason, did your success come at a cost?
There's always a tax. There's a price to pay. And I think, when I look back over the 2 decades that we ran that business, there was a lot of sleepless nights. There were some broken relationships. There were health issues that I suffered. And so, sacrifices that you make along the way for the greater good of going further and faster. And so I would never shy away from admitting to people that there is a high price to pay. And so the question then becomes, is it worth it? Is the payoff there? And, I'm pleased to say that in our case, the lives that we've been able to reach and impact have certainly made the sacrifices worthwhile.
And you said at the beginning there, you set up an ethical business. What does that actually mean to you?
I think, there's a lot of ways to make money in the world, and an ethical model is one that doesn't compromise your values, obviously is fully compliant and stays within the legal boundaries, but I think has a conscience as well. And in our case, we ran the SOS Health Foundation for more than a decade, investing into the lives of Indigenous communities around Australia. We've since been able to go beyond our domestic shores, and we've been able to do some very meaningful projects in Southeast Asia and the subcontinent. And I think it's us realising we have been given a lot. And so to pay it forward, to add back, to not just give a handout, but a leg up to other communities is really at the crux of our business model.
And Jason, you're now involved in philanthropic work, and you're also looking to mentor aspiring entrepreneurs. Tell a little more about what you're doing in that space.
Well, I launched the Iceberg Leadership Institute maybe 15 years ago, and it was really intended around developing professionals within our sector to become the future workforce for Back in Motion. But it's spun off into all sorts of directions now, where I find myself helping existing CEOs and executive teams transition from success to significance, this whole idea of a halftime phenomenon where they reassess what they're doing and how they bring purpose to their work. I spend a lot of time with emerging leaders, mentoring them one-on-one and in small groups as they're either launching brands or being involved in community work or social enterprise. And so I find there's no shortage of hunger out there for learning and development. And it feels like, because I have been given so much from others, it makes sense to be able to add back in this way.
Jason, thanks so much for joining us on The Wealthy Effect.
Thank you.